Good morning, ladies and gentlemen. This morning we have a pleasure to present to you a snapshot of the Health Sector Strategic Plan 5 that will start to be implemented in 1st of July 2021 to June 30th, 2026. As you've all seen, the theme for the HSSP 5 will be to leave no one behind. That rhymes very well with the focus of the universal health coverage. And this presentation actually will explain the framework that had guided the formulation of this strategy, but also we are going to share with you the highlights of the strategic priorities of this plan. We'll also have an opportunity to give you a summary of costing and resources estimates, but also share with you the monitoring and evaluation framework that will be used to monitor the performance of indicators and various areas for the next 5 years. So when you look in the HSSP 5, it covers the introduction, whereby we have provided the process and the framework that will be adopted. We are also going to share with you the background, national policies and strategy. And in this area, we will share with you the genesis of the Health Sector Strategic Plan, but also we will share with you what are the national policies that the HSSP 5 has aligned with and the strategies that will be adopted. We'll also give a snapshot of situation analysis, and this will cover the provision of health services and also the health system's performance. And after that, we'll share with you the existing and emerging priorities to be addressed. These ones came out from the midterm review of the previous strategy, the Health Sector Strategic Plan 4. We will also have an opportunity to get to know the mission, vision, principle, and values that will guide the implementation of the strategy. We are also going to have a chapter on the strategic outcomes. And in this strategy, actually, the difference between what we had in the previous strategies, previously we used to have the strategic objectives that we are focusing more on inputs. But this time around, we are going to focus more on results. And with these results, actually, we'll focus what are the outcomes in terms of provision of services, but also we will focus on what will be our results that we are targeting in terms of the organization of services. Also, the performance of these services that we intend to have. But last but not least, we'll focus on results that will focus on the investments that will be made in the sector, but what also are the expectations in terms of their functionality. Other 3 chapters in the HSSP 5, they are related to management and governance. Also, we will share with you an overview of costing and resource envelope, and the last but not least, the monitoring and evaluation. So when you look on the framework, the HSSP 5 is a 3-tier kind of approach. Our outcomes and impact of services will focus on society and individuals by ensuring that we have more people achieving provision of universal access to services, but also will focus on increasing coverage and quality. Another outcomes and impact that we expect from the HSSP 5 is to ensure that we have more people protected from disaster, those are having a well-being and healthy lives through the social determinants of health. So when you look on these outcomes and impacts, actually we have taken the inspiration from the WHO triple billion targets. So we as a member of WHO, we felt probably we should contribute to these triple billion targets set by the WHO. We'll use the process of people-centered, and here we'll focus more on empowering communities, strengthen the governance across all levels. reorientation of healthcare, improve intersectoral collaboration, and to integrate monitoring and evaluation systems. With the inputs of the health systems, here we are going to focus on the building blocks of the WHO that has, in the African region, we have the 7 attributes. So what we're intending to do in the next 5 years, we expect to see more interaction of the inputs that we've just shared, processes and outcomes. So the strategic plan actually have tried to put the right inputs, and especially in human resources. But also we need to do things in a correct way, and also focus on achieving results that have maximum impact. So as we learned from the implementation of HSSP4, actually one of the recommendations that was made is to focus on improving the processes. This is on the how we provide services. So the HSSP5 has adopted the WHO people-centered care approach that focuses on governance and the other 4 areas that I have alluded. But when we look in our context on the people-centered care, our focus will be on having more decentralization of policies, but also we need to see how best we are going to improve the community-based care, accountability, and on the reorientation of services, our focus will be on quality improvement framework, but also we need to see how best we are going to enhance public-private partnership. Vision and mission of HSSP5. The vision of the Health HSSP5 is to have a health and prosperous society that contributes fully to the development of individuals and the nation. The mission is to provide a sustainable health services with standards that are acceptable to all citizens without financial constraints, based on geographical and gender equity. Principles and values in HSSP5 will focus in 3 areas. The first area is on increasing equity in terms of increasing coverage for vulnerable groups, including urban poor. And in equity, we will also focus on services for underserved geographical areas. The second value will be on gender, and the HSSP5 aims to support gender balance in management and governance, but also address gender-based health needs. The third value will be driven on health in all policies, and here we'll endeavor to address social determinants of health, including issues related to intersectoral collaboration. So when you go to the strategic priorities, we will focus on delivery of community services, and the focus in this area will be on community health, health education, nutrition, and environment health. The strategic priorities in the area of delivery of health services in the area of the reproductive, maternal, newborn, child, and adolescent health will be on maternal health. We will focus more on quality of service deliveries by increasing capacity to staff to implement existing evidence-based intervention, but the HSSP5 will focus on making family planning services available to all people in need. On neonatal and child health, we will continue to strengthen the existing national programs and pay attention for urban poor with limited access to quality care. In the adolescent health, we are going to step up adolescent health services, especially for the vulnerable girls, improve adolescent-friendly health services, and focus on giving special attention for out-of-school youth. On reproductive area, we will focus on raising awareness about cancers, step up human papilloma vaccine programs, and also introduce screening programs for cervical, breast cancer, and male cancers. Another strategic area in delivery of health services will be on communicable diseases. And here we'll focus on continue to implement the malaria, TB, HIV/AIDS program. And here we'll put more emphasis on prevention and early detection for all 3 diseases. strengthen preventive measure to halt transmission of viral hepatitis, to have more integrated approach of disease control programs. Another area, the communicable diseases, will be on neglected tropical diseases, and here we're going to have more attention for community awareness and prevention, and have more focus on high-risk areas with targeted interventions per the disease, and also strengthen collaboration with partners involved in this area. Another area on communicable disease will be to strengthen One Health and zoonosis by having a close collaboration with the veterinary sector, but also have a vigilance, early detection and control of potential dangerous zoonosis like Ebola, COVID-19, Rift Valley fever. In the area of epidemics and disaster management service delivery, we'll focus more on detection, response, recovery, and antimicrobial resistance. And detection, we target on strengthening surveillance systems, whereby in response we'll focus on improving response systems, and recovery, strengthen the recovery programs. And on antimicrobial resistance, we'll have more focus on pharmacovigilance, prescription habits, and community awareness. In the delivery of non-communicable diseases, we'll focus more on having more prevention of NCDs, more screening of the non-communicable disease, better treatment of non-communicable disease, but also have more focus on strengthening the mental health. In the equity and social determinants of health, we'll have more focus on socioeconomic status, but also strengthen the linkages between health and education. We'll also have a focus on neighborhood and physical environment and access to health, and focus on reducing the geographical inequity for all social services. Now we move in the organization of health services, and our priorities will be on health services. And here we intend to continue strengthening primary healthcare services by capacitating decentralized management. The second priority in the strategic outcomes is the organization of health services. And in health services, we intend to continue strengthening primary health care by capacitating the decentralized management. This is from the regional health management teams, council health management teams, and also the management teams for the health facilities. We'll also improve the health services by improving urban health, mainly through the public-private partnership and collaboration with non-state actors. We'll strengthen regional hospitals as innovation health hubs for their geographical areas. And last but not least, we intend to capacitate specialized hospital for reducing referrals abroad. The other area, the organization of services, will be on the referral systems, and in the next 5 years, we intend to establish functional referral system with gatekeeper system at council level, and initiate a functional 24 hours, 7 days ambulance service. Another area where we intend to focus on the organization of services is the rehabilitation and palliative care. And here we'll focus on more provision of services to the aging population, and also will strengthen the home-based care. We'll also collaborate with NGOs and private providers as main caregivers. The third priority areas is in the health systems performance. And here we intend to expand access to care. This will align with increasing access in terms of infrastructure and capacities for the primary health care in remote areas, and for the vulnerable groups, whereby we intend to provide to them a universal health insurance scheme. Another area on services that we intend to continue focusing on is to improve quality of care, and this one will be done by moving forward the star rating system into a single accreditation systems to all providers, have a quality improvement programs and teams in integrated operations, and operationalize the patient's charter. And on support services, we intend to strengthen laboratory services and imaging services by having them more standardized and make them accredited. And also will intend to expand services for blood transfusion. Priorities in human resource for health. We'll continue to focus on improving training health institutions in terms of infrastructure and staff. Establish new courses addressing demands due to innovation, services, and technology. And in terms of planning, we'll continue to promote allocation of staff based on workload needs, but also using information technology to analyze health facility performance as well as individual performance. And in the area of deployment, we will increase placement of new trained staff, improve retention, enhance continuing professional development. And in the area of nurses and midwives, we will do an innovative training courses and respectful nursing care. In the health systems investments, our focus in the infrastructure will be to expand and maintain infrastructure with a focus on equitable access to care. But also we'll continue to address issues related to water, sanitation and hygiene, waste management, and electricity needs in all health facilities. In the area of medicines and supplies, we'll continue to do a further rationalization and harmonization of supply chains and align the essential medicines to the intervention. And in the area of information, communication, and technology, we'll expand the use of ICT in all areas. And also, by doing so, we are going to guarantee the privacy of patients, workers, and data protection. We'll also focus on using integrated ICT systems, operationalized, but also having an interoperable mechanism to align all applications. We'll also continue to build capacity of staff to operate innovative systems. In the implementation arrangement, this one will be elaborated later in the subsequent presentation made by the Chief Medical Officers. But our focus area will be to continue decentralized management, capacitating all levels to perform tasks in planning, management, and monitoring, informed by the GAP. We'll also continue to enhance collaboration between the ministries and other sectors. But also we are going to improve participation of population in management of health facilities and align and strengthen community management of health. On the governance, we will continue to strengthen and decentralize sector-wide approach to regional and council level. We'll also revitalize and rationalize relevant sector-wide approach structures. This includes the clustering of the current technical working groups. We'll enhance coordination, communication, and alignment of disease control program, and also map and streamline resources at peripheral level, make them visible in resources provided to the health systems. The cost of HSSP5 will increase from 8 to 11 trillion shillings. And as you can see from the graphs, most of the costs will be attributed to the provision of health services, whereby just over 50% will go into the direct service delivery cost, and just below 50% will go for the health systems strengthening. So when you look on the distribution of cost vis-a-vis the numbers of people that will be reached by level, you will find that more of the cost will go to the community systems, followed by dispensaries, and the third bit will go to the health centers, followed by district hospital, regional, and last but not least, zonal, specialized, and national hospitals. And in terms of the distribution of this cost, in terms of drugs and supply by level, a big chunk of cost for drug and supply will go into the zonal and specialized and national hospital, and it will go into reducing protein according to the level of services. HSSP5 would avert nearly additional 200,000 deaths, and this is compared to the status quo of the HSSP4. And when you look on the boxes that are indicated on this slide, you will see that the child health drives mortality reduction nearly to 125,000 deaths, followed by TB, 33,000, non-communicable diseases, 27,000, and for HIV, 4,000, and the maternal health, close to 18,000. And these estimates were based on the moderate investment scenario, where we have assumed that we are going to have universal health insurance. So when you look on the investment that will be made to the HSSP5, more than 400,000 healthy lives years will be gained in the area of non-communicable diseases. As you can see in the graph, more of the health life years gained will be on the chronic obstructive pulmonary diseases, followed by the epilepsy and other diseases indicated in these organograms will be gained. Okay, now we move to the costing assumption in terms of the resource available vis-a-vis the resources needed. Here we do have the two scenarios for the resources available. This is the primary scenario, whereby we have taken into assumption that if we continue with the status quo of having allocation of resources for the sector. The second scenario is the universal health insurance scenario. Here we are taken into assumption if the universal health insurance comes into opposition. So when you look on the resource available vis-a-vis the resources needed, in both two scenarios there is no gap, resource gap. But in terms of the rollout of the universal health insurance, it will allow for more ambitious implementation of the HSSP5. In the monitoring and evaluation of HSSP5, we are going to have the input and process indicators, output indicators, outcomes, and impact. In the input and processes, we are going to have the indicators for the 7 building blocks of health systems. And in the output, we will focus on indicators that will measure the access to essential services, the quality of services, demand for services, and also the resilience in service provision. In the outcome indicators, we'll focus on the areas of coverage of essential services, financial risk protection, responsive services, risk behaviors and risk factors. And on the impact, it will focus on having a health and well-being for all, improved health outcomes and equity, social and financial protection. So the indicators for all elements that are listed in the inputs, outputs, outcomes, and impacts are listed on the banners that we have displayed, and we have about 59 indicators in these 4 areas. This time around, we have also managed to have baseline estimates for all indicators. I would like to end up this presentation by giving you 4 take-home messages for the Health Sector Strategic Plan 5. First and foremost, as presented, the HSSP5 aims to accelerate progress towards sustainable goal number 3 within the lens of universal health coverage, improving epidemics and disaster preparedness, and also address social determinants of health. Secondly, HSSP5 aims at innovative approaches in use of technology, quality improvement instruments, and development of human resources for health. Third, HSSP5 aims at improving governance, decentralized management, and intersectoral collaboration for addressing community needs. Fourth, but not least, HSSP 5 aims at creating universal health insurance schemes to allow for ambitious health systems and services development. Thank you very much for your kind attention.